be me
Okay,
and
fine.
Dr. Robert.
Yeah.
All right. Um, a very, very warm good evening to all Johnites out there joining us. This is a very, very special episode from the St. John's Medical College Alumni Association. And we are here. We have just finished the India-England test match. And we have someone joining us all the way from England. This is actually our first Johnite joining us from the United Kingdom as such. And today we are going to be talking everything about the gut, straight from the gut. They say a way to a man's heart is through his stomach. And today we are going to have a very, very special guest talk to us straight from the gut about many, many different things. And to introduce him to us, and of course, a big to welcome all the Johnites joining us across the globe, I would now like to invite on stage, on screen, Dr. Anthony Robert Charles, President, St. John's Medical College Alumni Association.
Thank you, Nitin. I can see you're all pumped up by that cricket victory, and I can see you just champing at the bit to have a go at Professor. Good evening, all Johnites. We're back with our series on Johnites who have made a big difference and Johnites all over the world. So we are going in sequence. If any of you want to suggest a few names, please log into our website and do nominate a person. And it's an absolute joy and honor to introduce Professor Dileep Lobo. He's somebody that a lot of us have looked up to, not just for his sense of humor, not just for his, as they say, a very laconic style of putting an important point across, but I think most importantly for his academics, for his contribution to fluid dynamics and surgery, hepatability. I'm sure Nitin will do a good job of introducing him formally. But he's somebody that I have not interacted with for too many years, but in the last 2 years, I have been very, very, very enriched by my interactions with him. Like I said, he doesn't talk much, but he's extremely pointed in his observations, very surgical. And to introduce this famous GI surgeon, and as Nitin said, way to the heart is to the stomach. I'm coming straight off from doing a colostomy for a newborn. So we are on the right track. Dr. Dilip.
Right. So there we have our very own PROJ, as he is known, Professor Dr. Dileep Lobo, very, very distinguished alumni from St. John's. He did his surgical training in PGI and then went on to pursue a career in the United Kingdom. He's one of the leading authorities in perioperative management of surgical fluids, electrolytes, lot of research, lot of awards and grants, more than 350 peer-reviewed articles. He has been awarded the prestigious Hunterian Professorship from the Royal College of Surgeons in England, a lot of orations. He's the chairman of ERAS, which is Enhanced Recovery of Surgery After Surgery Society. His academic accomplishments are too short, are in fact cannot be covered in about 2 minutes as such. But we are going to discuss that and much, much more today. Professor Dileep Lobo, great pleasure to have you with us. How is it looking in England after the defeat against India?
Well, it's sunny today. We had rain all this while, but today the sun's out. So I suppose we're all celebrating the Indian victory. And before we start, I'd just like to thank Robert Anthony and you and the Alumni Association for this very kind invitation and for the honor to be a Johnite.
Right. You have been inspiring, and we know that over the years, even on the Facebook Johnite group, we have gotten used to listening to your name, your observations, and all that. But we are going to go right back to the 1980s. How did the decision to pursue medicine come about?
Well, I think it started from childhood. And my parents were both non-medical. My father was an architect. My mother was a teacher. And there was no pressure to, go into any field as such. I was given a free hand. And I really don't know why I was attracted to medicine, but I think from the age of 5 or 6, I always wanted to be a doctor. And there's no reason for that, but I somehow fulfilled my childhood ambition.
All right. So the question really comes as to How was it getting into St. John's Medical College? Any memories of the entrance examination and the board interviews that took place, and the moment when they all say the first step which you took into St. John's?
Yeah, well, it's a long time ago, but I've never had such a rigorous set of interviews for any post in my life. And 5 days of interviews is a bit daunting, but we somehow got through it. And I think I probably did all right. And so I was offered a seat. And it was quite exhilarating to know that I had been selected, because before the St. John's interview, I had a seat in the Armed Forces Medical College, Pune, but I wasn't terribly keen on doing 5 years in the army. So I think it was a bit of a relief to get into St. John's. And I think on the whole, it did my future career a world of good.
All right. So you got into St. John's, and usually they say that in the first year you can almost, for some strange reason, be able to, distinguish between a surgeon and a physician, depending on someone's like for a physiology and anatomy. And in your case, it's going to be very, very interesting. But what was first year MBBS like? Did you at that point of time during the anatomy dissection realize that, yes, I am going to be a surgeon? Or were you more of a physiology a fan and realize that you want to be a physician?
Well, it's very interesting because in my year, that's the 1982 batch, all those who did dissection religiously became physicians, and those who didn't do any dissection became surgeons. Uh, all through my early MBBS career, I wanted to be a physician because I quite liked thinking that I was an intellectual, and I thought medicine had a lot of thought processes involved. But then as I became an intern, things changed slowly, and I thought it would be more useful to be a surgeon because you can actually do something for the patient.
Right. Any memories from first year? The first year seems to be the sort of formative year in more ways than one. It sets the ball rolling to the development of a Johnite. What was your memories of campus life during those times in the first 2 years?
Yeah, I think it all started with the, what do you call, the hostel orientation program, or HOP as they called it. And although we had a lot of fear about it, I think it was quite friendly, and we got to know a lot of seniors. And one of the great advantages of John's at that time is that we had only 60 students in each year. So we knew 5 people who were 5 years senior to us and 5 years junior to us. And so that camaraderie remains even to this day. And we still remember people and a number of anecdotes about the people. And one of the other advantages of St. John's is just not a medical education. You get an all-round education, and you're encouraged to go into extracurricular activities, sports, cultural. And I think you develop a certain amount of confidence that students from other medical colleges perhaps don't have. And it stands you in good stead for the future.
Right. So you have been a quizzer all along, and quizzing was a very, very sort of serious process in St. John's as such. Any memorable anecdotes of quizzing of that point of time? And at this point of time, I would like to tell all our viewers who are joining in, if you have any comments or questions to PROJ, Professor Dr. Dileep Lobo, please type in the comments below and we will get him to answer those questions. Anything you were scared to ask him also, please do type, and today we will get him to answer. So, Professor, about quizzing and your passion for quizzing and any anecdotes of quizzing.
It was all quite a lot of fun, and we had a really good team with myself, Arvind Sheshadri, David Francis, and Ganesh Kudva. And at that time, we won almost every competition there was in Bangalore and outside Bangalore as well. But the most famous anecdote is when we went to PGI Chandigarh for their own festival, and at that time, the St. John's B team beat the St. John's A team. And the reason for that was that Arvind Sheshadri didn't get coffee and he was drinking tea. And he said tea destroyed his brain, so he couldn't think of the answers. But I think St. John's B team, led by Mario De Cruz, beat us in that event. And it brought us all down to earth.
Yeah, sometimes possibly, you don't mind losing to the other college, but you wouldn't want to lose to your own college's B team.
Yeah.
But That really brings out the sort of camaraderie that was shared. So did Dr. Arvind Sheshadri come back and drink a gallon of coffee, or did he take revenge on the
Well,
mess as such?
for for the next quiz, he made sure he got coffee, but that wasn't at PGI. And when I joined PGI, again, I realized that coffee was in terribly short supply, and most of us had to drink tea after the ward rounds.
That's a very interesting aspect that you bring about. And one place which has lot of memories with Johnites is the mess and the hostel. So which hostel block were you staying in, and how did people like Michael the Doby, or the people in charge of the mess play a crucial role in those student years?
Well, I started off in A block top floor, and then I moved to D block ground floor, and finally, when I became an intern, C block, which is the famous ladies block, was converted into a men's block, and I moved to C block. So apart from B block, I've lived in all the blocks, and I mean the hostel was fun. The mess, although a lot of us cribbed about the food, it was reasonably good. And I remember in the first 6 months when I joined St. John's, I was underweight, and I went to normal weight in the first 6 months. But everything was fun there, and I think the fact that we had all the facilities in the hostel campus, including the sports field, made it a really good experience for us, because we came back from classes, went and played some sport, had a shower, had dinner, and then went off to the library to read. So we were not just bookworms, but we had an all round development. And as I said earlier, that has stood most of us in very good stead.
I want to touch upon this point in a sort of a larger role to look at sort of medical education system right now. And with competitive entrance exams coming up, you have MBBS students reading all the entrance exam books right from second year MBBS itself, which was possibly not at your point of time. How did you prepare for exams, and what is your take on the current medical education system both in India and UK?
Well, you may call me an old fart, but basically, I think things have gone to the dogs, because at that time we weren't pressurized into taking time off to prepare for entrance exams, and we just did every exam while we were, you know, in the medical college, or while we were working. And I'm totally against this principle of people taking a year or two off and sitting at home just to prepare for entrance exams. Because at the end of the day, when you start working on the wards, basically what you do is what you've learned practically and not what you've learned theoretically. And I very often say that sometimes the really good doctors are not those who excelled academically, but those who had an all round development, and they learned how to look after patients, make a correct diagnosis, and institute the right treatment. And you don't necessarily learn that from the books.
Right. So, were you one of those who used to get very, very nervous before the previous day of the exam, flipping through those books go till you reach the exam hall? Or do you have any interesting anecdote to share about an exam ritual or an exam preparation?
Uh, I mean, I think with an exam, although we all like to cram at the last minute, your performance depends on what you've done in the past few months rather than on the last day. And I remember before the community medicine exam, Irvin Lasrod and I was so fed up reading Park and Park that we decided to go for a movie. So I got onto
Oh,
a
wow.
scooter, and I think we went to Blue Moon, watched the movie, and came and did the exam the next day. And this was the university exam, not the internal exam. So I think you've got to. I'm not recommending this to the students, but I think you've got to play to your strengths and your weaknesses and decide what you want to do. And really, if you're fed up, you're better off going and diverting your attention and clearing your mind, and that may sometimes help you perform better.
Wow, I mean, that's really a brave thing to do, that going to the movie. And like you said, all MBBS students watching this is a disclaimer. This is not part of any guidelines. But so which was so talking about movies, what used to be the hangout spots for you and your batchmates as such, be it, in terms of movie or, in terms of places to visit to eat in Bangalore at that point of time?
Yeah, so I suppose Bangalore at that time wasn't as developed as it is now, and we had a few movie cinema halls on Brigade Road, and I think the ones we often frequented were Rex and Blue Moon, Blue Diamond, Symphony, and I think the Lido, which was right out of the way. Uh, but we used to often have videos shown in the mess as well. And again, restaurants weren't that many. I think, if you ask me, we had a Chinese place in Koramangala, which was run by husband and wife. So we used to go there quite often. It was in the back of their home. And then the usual ones on Brigade Road, which included the Only Place, Corner House, and the Rice Bowl. I mean, my memory is not that great now, but those were the ones that we often frequented.
So,
And
so
then
the
for
reason
pastries, we go to Sweet Chariot.
Yeah, so the reason I asked you is, did these restaurants play any decision into take up a further super specialization in the field of GI surgery? But before we go there, um, you made a very interesting point that all along through your MBBS, you felt that you wanted to become a physician.
Yeah.
When did that moment come about when you decided that surgery was for me? Or was it something that just happened out of chance?
Well, it's a very silly incident, and I was an intern in Professor Alfred Mascarenhas's unit, that's Unit One, and in the middle of the night, I was assisting Rajkumar Shah on a case, and I just removed the artery forceps with my left hand. And whether he meant it or not, I don't know, but he said, "You've got quite a lot of manual dexterity, and have you considered being a surgeon?" And that sort of got me thinking, and I enjoyed the rest of my surgical posting, and I did a month's elective with Dr. Norman Guido in plastic surgery. And I think that just moved me towards surgery because you could do something for the patient, you could make the patient better. And, when you're a medical student or an intern and you stand at the back watching someone operate, it looks very glamorous. But only when they give you the knife in your hand, you realize that it's not always glamorous and sometimes it can be quite difficult. But it's a challenge that's worth taking. And I have enjoyed the challenge ever since then.
Okay. And from then you moved to one of the premier institutes in the country, which is PGI, to pursue your MS in general surgery. Uh, how was residency in PGI as such? Because we have heard, there's a sense that sometimes it's very, very challenging, it's gruesome. If you were to look back upon your residency in surgery in PGI, if I was to ask you what are the three things that sort of stand out, what would it be?
Yeah, well, the words you've used are right. It wasn't really gruesome, but it was really rigorous. And most of the time, we used to start work at about 6:30 or 7 in the morning and continue till about 10 at night. If you ask the modern day medical student or junior doctor, they'll say this is in violation of all working time directives. But the thing is, in 3 years, we learned almost everything that there was to learn in surgery. We had seen every possible operation, and the training there was really excellent. So I always say that I learned the science of surgery from Professor Khanna and the art of surgery from Professor Bose. And then there was Dr. Gurpreet Singh, who recently retired as the head of Department of Surgery at PGI, with whom I wrote my first paper. And I think I learned the art of writing from him initially. So it was a fantastic time. We still had time to have fun outside the hospital, but we worked very hard. But I think the what was packed into those 3 years was tremendous. And if you look at the residency in the UK, for instance, you can spend 7 or 8 years trying to do all that we did in 3 years over there.
I think almost, that's a very good point, because my next question was, having trained in India and now sort of being a mentor, guide, and a professor to trainees in the UK, how do you compare the two systems of residency in surgery? Both would have their pros and cons, but from your years of experience, what would you say are the strengths and challenges of both systems?
Yeah, I think the days of working from 7 to 10, 6 days a week are gone now. And no system, I think even in India, that's that won't be allowed, because you do have to have some relaxation, you do have to have some rest, because what's been shown now that if you are overworked, you're more likely to cause errors in judgment and also errors in the treatment of patients. But surgery is learning surgery is a long process, and it also depends on your skills. Like someone may you may take them through 10 hernia operations and they may still not be able to do it. And there are other trainees who you show them how to do it twice and they can do it as well as you. So the problem in quantification of surgical training is these factors are not taken into account, and people just look at logbooks. And someone who's done a lot of operation may be expected to be good, but what you've got to realize is it's just not the operating that's important, it's the decision making, it's the investigations that you do, and most importantly, it's the rescue of the patient with complications. And what's been shown is that a lot of patients come to harm because of failure of rescue. And with shorter training hours, you don't learn to treat the complications because you haven't seen enough complications. And I think that's really important. And so now in the UK, for instance, the newly appointed consultants often have someone backing them up when they're on call. So if there's a difficult case, someone's available to help them.
Oh, wow. Okay. So, in short, I think sort of getting a sense of what you're telling is that it's doesn't come down to the number of surgeries you're trained on, but clearly the quality of teaching which has gone into doing those surgeries correctly. And also, it just doesn't end there, but also having a follow up of those patients and learning to manage the complication. And I think these sort of should be the foundation of the residency course.
Yes, and it's also communication skills, which, to be fair, we weren't taught any of these in my time in India. But I think that's really important, because if you communicate well with your peers, with your seniors, with the other healthcare professionals, the patients and relatives, a lot of problems can be nipped in the bud, and you don't get complaints coming in. Most of the
True.
complaints that we get are not because of mismanagement of the patient, but it's for failure to communicate clearly.
Right, absolutely. Um, you took a decision to move to UK. Um, how did the decision come about? Now, again, from sort of, I come from a generation when moving to UK was completely unimaginable because of the restrictions and how difficult it was to get in. Now, of course, things have again changed where getting into UK is possibly on the rise. But how did the decision to move to UK come? Why not USMLE at that point of time, or why not even continue in India?
Yeah, well, I had filled the forms for the PLAB, and at that time it was a huge amount of money. And I was doing my senior residency at PGI at that time, and then I had a doubt whether I should stay in PGI or whether I should go to the UK, because, as you say, at that time the outlook in the UK wasn't very rosy. You had 4 years of permit-free training. At the most, you got 5, and then you came back to India, or you went somewhere else. And I spoke to my boss, Professor Khanna, and he said, I would advise you to go. Not that you're going to learn something new, but you'll at least know that what we're doing over here is pretty good. And I think that statement was absolutely true. And I came to the UK with the idea of learning a few new techniques and probably going back to India in 4 years' time. But then I happened to meet Professors Simon Allison and Brian Rowlands, and my career changed completely after that. And I got into an academic stream. We had some really exciting research done. I got a distinction for my MD, and then I was appointed as a senior lecturer at Nottingham when I finished my training.
Was there any one incident which sort of made you choose that I want to go into GI surgery, or how did
Yeah.
the decision to
Well,
pursue that come about?
when I was in PGI, most of what we did was GI surgery, and I was always interested in that. And what I wanted to be was a GI surgeon, meaning looking after the gut from the mouth to the anus. But in the UK, GI surgery is subdivided into 3 different specialties. You have esophagogastric, hepatopancreaticobiliary, and colorectal. And because, I mean, I was always interested in HPV surgery, and I worked in an HPV unit in the UK. And so my training was largely in HPV, and that's how I came to be an HPV surgeon. But if you ask me, I would have liked to be a GI surgeon rather than an HPV surgeon.
All right. Is there anything daunting that you come across in the field of surgery, which sometime in your journey in UK made you think that no, I should go back to India? Or was there any that one case which really taught you something and changed your outlook as such?
No, I don't think you could put it to one case, but once I got into the stream of training that I finally ended up in, there was no question of going back to India. Because if you're going back to India, you have to go back early because you lose all the seniority, and then people don't really value your overseas experience in India. At least at that time, it may have changed now. I don't know. Uh, but I don't think you can pin your experiences down on a single case. But we all do difficult cases, and with HPB, even if you've done the operation well, you can still have a major complication. And I think you've got to learn to live with those complications, because although you feel bad if a patient has a major complication or dies, you still have to rise above that and treat the next patient of yours to the best of your ability. And so that amount of resilience has to develop in you. And again, we recently did a survey on burnout in the UK and among surgeons, and we found that the older surgeons were more resilient because they had seen it all and they knew how to get over misfortune or complications or complaints, whereas the younger surgeons sometimes took these things very seriously, and a few surgeons have even left the profession because of this. So I think it's really important for a surgeon to develop that resilience and know that we do have complications. Complications are unavoidable. They can be reduced, but they're not completely avoidable, and we have to learn how to treat the complications. At the same time, we have to realize that a certain number of patients of ours will die despite of what we do.
Well, that's completely fascinating to hear about the burnout survey. And I think the one word which really stands out from you through the theme of this interview is resilience. I want to get a little personal here. Uh, did you ever encounter a situation when your resilience was tested in the operating room or otherwise in career as such, where you really had to dig deep into those reserves to fight it out? Any
Yeah,
of one which comes to your
I,
mind? I
I,
know
I
it's
think in the operating room, your resilience is always tested when you get what you call audible bleeding, where the blood hits you in the face. And I think you have to call for help early over there. And sometimes, especially when you're doing HPV surgery, if you have catastrophic bleeding from the portal vein, sometimes it's not possible to control it. And you can often have huge blood loss and then have to institute major hemorrhage protocols. But again, from my research point of view, I think that tells a better tale of resilience. So the importance of having a plan B, because I had funding for my research for a project on immune enhancing nutrition in patients with cancer. And we had the blood of 120 patients stored in the freezer. And when I came back one Monday morning to work, I found that there was a puddle of water outside the freezer. And apparently, the cleaner had switched off the freezer on the Friday evening, and everything that was in it had melted and got destroyed. And most people would have been distraught with that, but I think that was the best thing that ever happened in my career, because we had a plan B. We were doing this really exciting work on fluid and electrolytes, and I think that's what helped me build my research career. Because if I had just zeroed in on the immune enhancing nutrition, I would have just been one of the other guys who's done a project like that. But the work that we did on fluid and electrolytes was completely new, completely innovative, and it's helped change practice in my own lifetime, which doesn't happen with a lot of research.
wow, it's almost like a Alexander Fleming story of the
Yeah,
discovery of
well,
penicillin.
I'm not at that level yet, but yes, there is a story told that if Fleming was applying for a grant today, he wouldn't have got any money because he couldn't have predicted that he was going to have an accident in the lab and he was going to produce an antibiotic that would have saved millions of lives. So, I mean,
No,
that again is one of the problems with grant funding nowadays, is that, if you take something completely off the cuff, most funders will not even listen to you.
no, and I think just uh, uh, the resilience. I mean, anyone doing research, you find the fridge which has all the samples completely gone. I mean, that's a great story for all the youngsters and mid-level faculty listening. That it's always very important to have a plan B, and sometimes accidents can lead to greater things in life. Research. very, very odd, with no disrespect meant, for surgeons to be involved in basic research, if I may put it as such, in terms of molecular research, in terms of doing hardcore basic research as such. How did you develop a passion for research? Because you have more than 350 peer reviewed, you have a very high H index. What were the roots of trying to get into research at a time when possibly doing research was not the in thing or the fancy thing?
Well, I think it started with disappointment in St. John's because when I was a medical student, David D'Souza and I got together and we did a project with Dr. Patrick Kamath and Anurag Kurpat, trying to form gallstones in hamsters and trying to prevent the formation of gallstones. And we did a lot of work on that project. And all we learned from that was how to rear hamsters and that hamsters ate their babies. The whole project was a failure and we didn't get anything out of it. And most people would have sort of got disheartened about it. But I think that was the best lesson I learned, is that you have to cope with the failures of research and you've got to learn something from your failures. And that's what I tell my students, that you know, if you're doing a PhD, even if the research fails, you'll still have a PhD. You may not get any publications out of it, but you need to write it up so that other people learn not to make the same mistakes again. And then when I went to PGI, I did my uh, MS dissertation on enteral nutrition in surgical patients, and we wrote a few other papers. And so I learned the style of writing and I learned some basics in research. And then when I came to Nottingham, I happened to meet the newly appointed Professor of Surgery, Brian Rowlands, and I worked for him. And there was Simon Allison, who was the Professor of Clinical Nutrition, and he and I got on, really well from day one. And in fact, just today, he and I have had another paper accepted. And although he's 85 years old, we still collaborate and we still do good work.
So, if today there's a young Johnite medical
So,
student,
isn't the-
no, please carry on, carry on.
sorry? No, so as I was saying, you have to have a reasonably broad field for research, but you've also got to have some really specialist areas that you concentrate on, because you can't be a jack of all trades. And again, with the basic science work that we've done, you've got to establish collaborations with the basic scientists. And again, we've got a Nobel Prize winning MRI center in Nottingham, and we've done a lot of innovative work with them, because the whole thing of successful research is to collaborate and innovate and not duplicate resource. And just as I wouldn't expect an MRI physicist or a basic scientist to come to my operating theater and operate, similarly, they don't expect me to come and do the calculations or do the RT-PCRs in their lab. And just as I would do an operation much better than them, they do the basic science much better than me. But we have to learn to talk the same language, and we have to collaborate and live in an atmosphere of mutual respect so that we get the best out of both worlds. And that leads to higher quality papers and better productivity.
So, today, if there's a young surgeon who's watching this, who wants to get into research, or even a young medical student who's watching this and wants to get into research, what would be your 3 points of advice for him?
I think the first thing, don't do it for the sake of doing it. You must be really interested in research, because you have to learn that there are failures that could occur, and sometimes those failures can be really disheartening. It's almost like a patient dying. If the cleaner comes and switches off the freezer and destroys 2 years of your work, that can be really disheartening, but you have to learn to get over it. And at the end of the day, every piece of work that you do does not result in a publication. And so you have to be prepared to dig your heels in for the long haul, because things are not going to happen immediately. You're not going to get results immediately. But you have to develop or learn the techniques, develop the skill of writing, because I think writing is really important, or good writing is really important, because when you submit a paper, if it's well written, that's half the job done. Because if the editors and reviewers have to struggle to understand what you've written, then that paper is very unlikely to get accepted. So it's the overall process that you have to learn while doing formal research: critical thinking, learning research methodology, learning to write. And most important, you've got to be honest with your work, because the last thing you want is to have fraudulent work published and then get discredited. And there are people who've had more than 100 papers retracted in their own lifetime, and their careers have been completely ruined because of not paying any attention to detail or because of frank fraud.
All
Okay,
right.
so we have
So
a question over
we
there.
have a question coming in from one of the recent
Yeah.
students. That is, I think we touched upon it briefly, but I think the focus more is on the hands-on experience, because in India, possibly in first year, you do not get that many chances in the operating theater, and it's possibly more from the second year and third year as such.
Yeah.
So, how's the hands-on experience in UK as compared to a residency in India?
Well, so in India, the volume is much greater than anywhere else in the world. And so if you're in a good residency program in India, you will do a lot. And in PGI, for example, in the first year, we did very little surgery. On the second and third years, we did more. But when you became a senior resident, you did almost everything. So in 1 year of senior residency in PGI, I had done much more operating than I'd done in 3 or 4 years in the UK. So in the UK, again, the volume is low because you don't operate every day of the week. You do a fair amount of emergency operating, but again, you learn other skills. And at the end of the your residency or training in the UK, most people come out as competent surgeons. So as I said earlier, it's not just the number of cases that you do; it's how you learn to do them, and developing good surgical technique. Because once you learn to do complicated procedures, you can do most other things. And in the UK, training is highly specialized, so there are very few people who are generalists and do everything. Most of us, like for me, I do one operation, which is a Whittles, and the other operation I do is a lap coolie. But I'm happy doing that because I've got a lot of time for academic work. I also do on calls where we do the emergencies, but you don't have to do a huge volume of surgery to keep your hand in. But at the same time, if you want to follow an academic pathway, the one advice I would give people is not to give up your clinical work, because the last thing you want to be is a non operating professor of surgery.
That's a very nice way to put it across, that ultimately your core fundamentals is something that you must always focus upon. You are also a Johnite couple, one half of a Johnite couple as such. How important has family been to maintain stability in career? Obviously, being in the field of surgery is demanding. How important has the role of family been in? And if you'd like to reflect back on any of those golden moments in John's for the Johnite couple.
Yeah, I think being a doctor couple is both exhilarating and also difficult, because both of you cannot keep pace of the career, and one person has to make sacrifices. In my case, my wife Annie made a lot of sacrifices to help me progress with my career, because again, when you come to the UK, you don't have family support, and the children have to be brought up well. They've got to be schools. You've got to take them for extracurricular activities, and both parents, if they have high flying careers, it becomes very difficult to look after this. But Annie thankfully sacrificed a lot. I mean, she's done very well, but perhaps she would have been an academic ophthalmologist as well, but she sacrificed that to see my progress. So I'm very thankful for that.
You mentioned a very interesting point, and for youngsters also moving to UK at this point of time, what are the challenges that a young medico or a young couple would face when they move to UK as such? And are things better now as compared to the time when you were there?
Yeah, I mean, nowadays, because of the working time directive, you do get time off. So, for instance, if you do a week of on call, you get the following week off. That does reduce the amount of exposure you get to training, but it also gives you time to recreate the work life balance. But it is difficult. Childcare is very expensive. And even when we were training, almost one salary goes on childcare. So you've got to be prepared to make those sacrifices. And again, at the end of the day, money is not the only reward for doctors. I think it's the satisfaction you get from a thank you said by a patient that is probably much more valuable than any amount of money that you can get. And Kevin Pereira, I remember when during the ragging, he called me and said, very few other professions get their clients come back to them and say thank you. And I think that drives us forward. And you can have a lot of money, but if you don't have the time to spend it, what use is that?
Absolutely. And I think for all of us in this profession, the gratification of saving a life, the smile, or even just knowing that we made a difference in someone's life is what possibly keeps our passion going through. You are a very reputed professor, but you're also known by a more reputable name, Proj. And in the time of the glory days of Facebook, we used to see the Proj, Watch, Dodge, and a really, really active bunch of people. So, what's the story behind all these OJs or OJs?
Yeah, it all goes back to Dilip Wilson, who was 1 year junior to us, who had this knack of saying things that very few people could understand. And I think the first OJ was Joe Verghese, who was called Podge, and Joe Verghese is in New York now, and he's a very successful clinician scientist over there. And then Wodge himself christened himself as because he was Wilson, so he became Wodge. And then several others happened. So I was Proj, Irvin Lastrada was Dodge, Mario de Cruz was M Dodge, Carmel Joseph was Codge, Boris Mascarenes was Bodge. So basically, Bodge has got some very strict criteria to confer the title. And you've had to have done something in St. John's, which is not necessarily academic, but something that made you either famous or notorious, and you should continue to do the same work once you left St. John's. And any title that's given has to be approved by him. So it's all a bit of fun, but I think it's helped get the camaraderie. And even now, we've got this group of people who are sort of contemporaries who we call it the Bushman's Group, which is led by Joseph Matthias Chandran, who's the Bushman in chief. And we meet at least once a year for a week, a boys' week, somewhere either in the UK or abroad. And it really helps maintain those relationships. And again, in COVID, it helped us tremendously because every other week we used to have a Zoom conversation with this group. And I think it helped us, keep going during COVID. And also, even now, we had the last conversation this weekend. And it's all fun. We sometimes tell the same jokes several times over, but it keeps us going and it keeps that bond in place.
I think possibly entry into the OJ criteria for that is possibly more strict than any of the certain orations you would have received, possibly. But you mentioned a very important point, and I want you to reflect on that, which is the camaraderie or the Johnite spirit. Being in a completely different country, how do you reflect back upon the Johnite UK group? And if you could sort of tell, because as part of the Alumni Association, I think our mission more has been to connect people, to borrow old this thing of Nokia connecting people. So how has the Johnite UK alumni group helped keep the Johnite spirit alive?
Yeah, so for a long time it was pretty stagnant because, as you said in the introduction, for several years we did not have any new Johnites coming in. They were all going to the US because it was very difficult to, have career progression in the UK. But now, over the past 6 or 7 years, we've had a number of young people come across, and they've done really well, and they've managed to get what we call training numbers. So in the past, most appointments for training were done locally, but now there's national selection. So there's very little individuals can do to influence that selection. But the people who are applying for the post, if they're very good, they do well at the interviews. And again, going back to what I said, that we get an all-round training in St. John's. And generally, people who've trained at St. John's are more confident, they speak better, and they answer questions to the point in an interview. And so a number of the young people who've come across recently have been successful in getting, good jobs.
Right. And what you did make a point that as a doctor, it's not just being by the books, being serious as such, and quizzing was your hobby. Your other hobby is actually you're a wonderful photographer. Um, um, how does photography help you maintain balance as a surgeon, or is it something which you completely dissociate from surgery? And how did the passion and interest for photography come about?
Well, that again goes to my childhood days because my father was very interested in photography, and he had what most people would not have seen nowadays is a Yashica twin lens reflex camera. But over the years, I got more and more interested. And the one thing that my father taught me was composition in photography. And, anybody can take a photograph, but, you've got to look at the lighting and composition to make people look at it again. So that's grown over the years, and at present, I have an old car, so my photography equipment probably is worth more than my car. But it does keep me sane. And I used to do a lot of medical photography as well, but now we're not allowed to use our own equipment to take clinical photographs. We've got to get the hospital photographer to take it. But most of the time, it keeps me sane, and I like going on trips over the weekend, taking some photographs. I don't do very much editing. At the most, I just correct for the contrast and brightness, but I don't use Photoshop or anything more than that because I still want to maintain the natural quality of the pictures.
All right. So it's my honor and privilege now that I'm going to be able to take a viva for the professor himself. So this is going to be
I might
um,
fail. I haven't
this
done
is going to
done an exam since 1998.
so you say it's never new to try some old things or new things as such. The rapid fire viva, your favorite book.
Oh, that's a difficult one. Probably Catch 22.
Fantastic. Favorite food item in India and UK will make it slightly easier.
Well, probably a dosa in India, and in the UK, I know a nice steak.
All right. Favorite holiday destination, again, India and abroad.
Wow. In India, I have no favorites as such because I like to go to different places each time. But abroad, it would probably be a toss-up between Spain and Sweden.
All right. So these were actually the easy questions, like how in Viva they just warm up before going for the kill as such. All right. Now I'm going to put you a little bit on the spot. Most fashionable person in your batch.
Hmm. I don't know, maybe Jyoti Idikula.
All right. I don't know what the others might have to say. You might have a lot of activity on your batch WhatsApp group today. Among boys,
Yeah,
among
I might get my knuckles wrapped.
right, among boys.
Well, we weren't terribly conscious as boys. I mean, we did have suits that we used to wear for hostel day and for other occasions, but I don't think boys were terribly fashionable in those days.
Oh, all right. Okay. Naughtiest person of your batch. We are not going to ask about the naughty exploit, but someone you would give the title of the naughtiest person in your batch.
Maybe Irvin Losrado, possibly. He
Oh,
still
all right.
continues in the same vein.
All right. And
we,
possibly,
we, we
perhaps,
always said that in our batch, no one received the Best Outgoing Student Award, but Irvin Losrado was conferred the Most Outgoing Student Award.
that's a very good one. I hope Dr. Arvind would watch this video at some point of time or the other. All right. Most flamboyant personality.
Oh, Leo Mascarenhas, he's still flamboyant, but he's not from our batch. He's 2 years junior to us.
Oh,
We still call
all
him
right.
Flamboyant Leo.
Flamboyant Leo. Okay. Flamboyant Leo. We are getting more and more nicknames as such. Okay. Favorite song.
I don't know. Those days it was probably We Are the World.
Right. Okay. One song which possibly you and Dr. Annie would connect the most or would listen to the most.
And probably some Billy Joel song, Just the Way
All
You
right.
Are.
Just the way you are, possibly fantastic songs. So, Dr. Dileep, it's been a great pleasure talking with you. I want to end this because you have been one of those who have been quite frank, outright, and also given a lot of pearls of wisdom and philosophy. And definitely, more particularly, as young surgical resident watching this would have gained a lot. What would you look as a vision for St. John's going forward in the next 10, 20 years? And for your ending message to young upcoming surgeons as well.
I think the main strength of St. John's has been the high quality of education. At the same time, St. John's has to learn to foster excellence rather than mediocrity. And if you go to the Department of Surgery at the Mayo Clinic, they've got a huge plaque over there which says, innovate, collaborate, and celebrate. And I think that's the essence of either clinical work or research. You have to be innovative. You have to collaborate with people. You can't do everything yourself. And most importantly, which most of us are really bad at doing, is celebrating success. And I think that is really important. And if you look at, the way you treat your trainees, if the trainee does something wrong, most of us are very quick to criticize them, but very few of us actually say, well done, if they've done something well. And I think those few words of encouragement do go a long way in making careers. And I give you my own example where all I was told was, well done for removing the artery fossa with your left hand. I don't know whether the person meant it or not, but it changed my life. And again, you should not block the path of inquiry in research. And people have to be allowed to be free thinking, but at the same time, you've got to play within the rules. You can't be free thinking and be dangerous to your patients or your subjects who are coming in for research. But the supervisors have to encourage their trainees to think and have ownership of their work. And therefore, I give my PhD students ideas, but I always encourage them to develop the idea, because when they read that thesis about 10 years down the line, they've got to say, I'm proud to read this again, and the work is relevant, and I did a lot of the work myself, rather than I did what my supervisor told me to do. Again, a lot of my PhD students have all had plan Bs, and sometimes the plan Bs have led to much more exciting papers than what's come out of their thesis.
I think one thing which has really come out through this interview is serendipity, and small things can make a big difference. Most importantly, not to be too serious, possibly perhaps even visit PVR before an exam, and who knows, you might get good marks in community medicine. Disclaimer, not part of any standard guidelines. And of course, more importantly, to have that passion and resilience in whatever you do. Any final thoughts for young upcoming surgeons, or what?
Two things. You spoke about serendipity, but it's got to be focused serendipity, because you've got to make the most of the opportunities that are given to you. A lot of people are given opportunities, but they don't make use of them. And I think in order to succeed, it's not only the opportunity that has to come your way, you've also got to put in the hard work to take that forward and make the most of that opportunity. And as a parting bit of advice to young surgeons, I'd just like to remind them of a quotation from René Leriche, who was a famous vascular surgeon, and many of you will remember the Leriche syndrome. And he said that every surgeon carries with him, or her nowadays, a small cemetery where from time to time he or she goes to pray, a place of bitterness and regret where he must look for an explanation for his failures. I think, as I've said all through, we've got to recognize our failures, but at the same time, we've got to try and rise above them and not repeat those failures.
Wow, those are some really heavy philosophical words to end, and I think very, very wise words, not just for surgeons, but for all aspects of medical professionals in some way or form or the other. It's been such a great pleasure having this conversation with you, our very own PROJ, Professor Dr. Dileep Lobo. A lot of comments coming in. Sparrow, Dr. Praveen Rodriguez puts in an emoji of a star. I'm not able to get who's this. Their handle name is Curiosity, but they have mentioned incisive and wise words or advice. And I'm sure that when this goes out along for people to see, it would be a wonderful thing. I would now like to hand over the stage back to Dr. Anthony Robert, President of the St. John's Medical College Alumni Association, to conclude the session. And for all of you Johnites watching this, please do subscribe to the St. John's Medical College Alumni Association. We go by the handle SJMCAA, so that you will be notified of all further events. We are having a little bit of difficulty in adding Dr. Anthony Robert. We'll just hang on for 60 seconds if we are able to try and hand. Just like Dr. Dileep Lobo went for an exam, we have George, our final year student, about 1 week before exam, managing all the university exams, managing all the tech work. George, despite all the technical difficulties. Thank you again for turning up for each and every event and ensuring most of it goes smoothly as such. We are just waiting for Dr. Auntie Robert to try to log in as such, and we have found a solution for it, as always, in the nick of time. So, Dr. Dileep, what's your prediction for the rest of the two matches? India, England?
I think it'll be 1-1, so we'll end up with 3-2.
Three.
Not the way Ben Stokes thought it to be, because he wanted it 3-2 in favor of the UK, but I think it'll be 3-2 in favor of India.
So very, I mean, this is a little bit of a controversial question, but whom do the Johnite UK people support when India plays England?
Yeah, I mean, I don't know if you heard of an ex-MP called Norman Tebbit.
Yes, I know. I'm referring to the
He had the Tebbit test for immigrants, and he said your true colors show which team you support in cricket. And most of us would support India any day if India were playing, and the Pakistanis would support Pakistan. And when you go to the matches, most of the crowd are from the local population supporters of the overseas team. So I would say I failed the Tebbit test.
All right. We have got one question coming in from Sparrow, Dr. Praveen, a very, very serious question. And he asks, what is your H index on the banter group?
Well, I would use Neil Rangel's terminology and say, I'm not sure.
That's a very diplomatic answer. So how does the banter group also play a role in the camaraderie as such?
Well, it's good fun, but sometimes it gets a bit too heavy because people just resurrect the same topic and go on, stretching it beyond the limits. But on the whole, it is very helpful, and people say that I'm a lot on the banter group, but it doesn't take a long time to post. And the advice given when you're working is that every hour and a half got to take a bit of a break and clear your mind and do something, and that's when you put a few posts on the banter group. And again, if you're watching television, your whole mind is not focused on TV, and then you can write something. And Sparrow is remarkable because he posts at unearthly hours. I don't know how many hours a night he sleeps, but he's all the time there posting.
But I think that's a matter of research for the ornithologists, the awake hours and the sleeping hours of a sparrow. I think that would be something which we can research upon
we
next.
Should call him
I think
owl rather than sparrow.
Right. So we have Dr. Andy Robert here. Dr. Robert, final words for us to end the show.
I am so happy that the professor has prescribed a therapeutic role for the banter group in people's lives. 1.5 hourly aliquot of 10 minutes of banter talk, I think, is what he's advocating.
10 minutes is probably too long. 5 minutes is probably all you need.
But thank you so much, Prof. And I think you're one of the few people who has managed to keep Nitin Yashas under a bit of a rein. You held him in. Of course, you were just jumping about the cricket matches. Yeah. And so thank you so much for today. And we hope to keep the banter coming in. And all the more, especially when it's coming from such an academic giant as yourself. And I personally want to recognize those absolute number of publications and textbook articles and the chairs that you've held. And I think that is something which most young Johnites will look up to. And that is one of the goals of this series, that youngsters will watch this on YouTube, and it will be put across by the Alumni Association on our website, so that it inspires future generations, that we have such giants in our midst who have come through from St. John's. So thank you very, very much indeed. And thank you, Nitin, for keeping the spirit.
And once again, thank you very much for the honor. And it's been an absolute pleasure for me.
Right. Thank you, George, for keeping all this going, and all the very best for your final exams. And for those tuning in, do subscribe to SJMCAA channels, and also log on to our website and register yourself so that you can receive regular updates of what the Alumni Association is up to, exciting new events coming up, exciting new initiatives also coming up, and also to just be in touch with each other. Thank you so much. Stay safe. Good night.
Thank you. Bye. Thanks, Nitin. That was great.